For short of time, we proceed to next lecture about cardiometabolic disease in young diabetic. Professor Inas Shaltout, Professor of Endocrinology, Cairo University, will speak about these important topics.
بسم الله الرحمن الرحيم. بسم الله الرحمن الرحيم. Thank you very much for the kind invitation. And I'm going to talk about the cardiometabolic disease in the young diabetic. And let me start with the young obese. The global prevalence of overweight and obesity in children and adolescents, 41 million children below the age of 5 are either obese or having overweight. And more than 340 million children between 5 years and 19 years old are either obese or having overweight. These are the causes of childhood obesity, which are complex and multifactorial: genetic causes, endocrinal, psychological, neurological, and hypothalamic, drug-induced, and environmental, which is the most common in the form of lifestyle. These are the complications and comorbidities of young adults or childhood obesity: prehypertension and hypertension, NAFLD, prediabetes and type 2 diabetes, hyperandrogenemia and polycystic ovary syndrome, proteinuria, focal segmental glomerulonephritis, pseudotumor cerebri, sleep apnea, early subclinical atherosclerosis, CVD, morbidity, and premature mortality in adulthood, and dyslipidemia. These are problems occurring to obese children: early puberty or menarche, eating disorder like anorexia or bulimia, skin infections, asthma. Overweight children also become overweight adults, and obese children become obese adults. There is increased mortality rate during adulthood, and other complications like cancers and osteoarthritis. Long-term effects of obesity during childhood: heart disease, type 2 diabetes, and stroke. And psychological problems: depression, low self-esteem, discrimination from family and colleagues, and emotional or psychological problems. The adipocytokines: many adipocytokines are secreted by the visceral fat in the form of inflammatory cytokines, interleukin-6, tumor necrosis factor, adipocytokines, adiponectin, and leptin. They are directly correlated with obesity and secreted from the visceral fat, and they are directly correlated to insulin resistance, hyperinsulinemia, diabetes, and hypertension. And also there is increased secretion of free fatty acids together with fatty liver. These are complications due to obesity and visceral obesity. And in this study about the association between body mass index, waist circumference, and waist to height score in both females and female young adults and children, there was increased level of triglycerides, increased level of triglycerides, increased insulin resistance, increased systolic blood pressure and diastolic blood pressure, and there was reduced level of HDL. So all the markers were increased in obese and those with abdominal obesity, both in girls and in boys. Type 2 diabetes will be markedly increased in children born after the age of after the year بعد سنة 2000. CDC Center for Disease Control في United States قالت in 1 in 3 children born after year 2000 will become diabetic in the future. So if we do nothing, we will have 30% of the adults having type 2 diabetes in the future. These are the causes. Children are sedentary with less physical education in school, more screen time. Only 50% of them get regular physical activity, and 14% of teenage do not do any physical activity. مش بيتحركوا، مش بيعملوا أي نوع من الرياضة. And these are the risk factors for childhood type 2 diabetes: family history, obesity, and the important is hypertension and dyslipidemia. The presence of hypertension and dyslipidemia is a risk factor for childhood type 2 diabetes, together with the non-alcoholic fatty liver disease. And this is new. The use of atypical antipsychotic medications was reported to be associated with high risk for type 2 diabetes, according to Diabetes Canada. These are the clinical features of type 2 diabetes at diagnosis, and we can find among them dyslipidemia in 44% of cases and hypertension in 28% of cases, and microalbuminuria in 14% of cases at diagnosis of type 2 diabetes in the young. This is an important question: when and how to screen. And according to AGA 2022, in overweight children and young adults, or obese children and young adults, having at least one or additional risk factor of the following: the maternal history of diabetes or gestational diabetes, family history of type 2 diabetes, signs of insulin resistance, or conditions associated with insulin resistance like acanthosis nigricans, hypertension, dyslipidemia, polycystic ovary syndrome, or small for gestational age birth weight. These children or young adults should have regular screening for type 2 diabetes. For type 2 diabetes in the young, these are complications. We may have short-term complications of diabetes, but we can have longer-term of complications like severe and early onset microvascular complications, including retinopathy, neuropathy, and nephropathy. These are some comorbid conditions. Dyslipidemia: we should do screening for dyslipidemia at diagnosis of type 2 diabetes, then every 1 to 3 years with clinical visits, and to start a statin if there is increased LDL cholesterol more than 4.2 millimole. Another comorbid condition or complication: hypertension, to screen for high blood pressure at diagnosis of type 2 diabetes and in subsequent clinical visits, and we start treatment if there is hypertension. This is the screening schedule. Let me concentrate on cardiovascular complications and risks. Here we are talking about neuropathy, retinopathy. For nephropathy, yearly screening commencing at diagnosis of type 2 diabetes, we start with screening for albumin creatinine ratio at diagnosis of type 2 diabetes in the young adults, and followed by yearly screening. For dyslipidemia, screening at diagnosis, then every year later on, in the form of fasting total cholesterol, HDL, triglycerides, and LDL cholesterol. Hypertension at diagnosis and in subsequent levels. NAFLD yearly screening, we do ALT and fatty liver on ultrasound. Polycystic ovary syndrome, obstructive sleep apnea, all are complications and comorbidities of type 2 diabetes in the young and should be screened on diagnosis and later on yearly frequency. Depression and binge eating, The young adults with diabetes have higher rate of cardiometabolic risk factors, which lead to increased disease prevalence and mortality. Those young diabetics are having high blood glucose متعرضين للhigh blood glucose for longer duration. ده بيعمل early cardiovascular complications and mortality sometimes and reduced life expectancy of young adults with diabetes. These are the estimated morbidity and mortality in adolescents and young adults diagnosed with type 2 diabetes, the causes of death, end-stage renal disease, coronary heart disease, and stroke, and the diabetes complications in the form of nephropathy, microalbuminuria, coronary heart disease, stroke, blindness, photocoagulation. These are the complications, and lower extremity amputation. These are some complications and some causes of mortality in young adults with diabetes due to long hyperglycemia. بيتعرضوا long hyperglycemia فترة كبيرة وبالتالي عندهم early complication and early mortality. Let me end with this item. How can we stop the cardiometabolic epidemic? بسيط جدا وأهم حاجة لازم تتعامل. This is the IGF recommendation for a healthy diet for general population. عشان أمنع الكارديوميتابوليك disease لازم أمنع obesity in young children and in young adults by healthy eating for general population. How to choose the food, choosing water, coffee or tea instead of fruit juice, soda or other sugar sweetened beverages, eating at least 3 servings of vegetables every day, including green leafy vegetables, eating 3 servings of fresh fruit every day, choosing not a piece of fresh fruit or unsweetened yogurt for a snack, limiting alcohol intake, choosing lean cuts of white meat, اللحوم, poultry or seafood, choosing peanut butter instead of chocolate, spread of jam, choosing whole grain bread, brown rice or whole grain pasta, choosing unsaturated fats زي olive oil, canola oil, corn oil or sunflower oil instead of saturated fats, butter, ghee, animal fat, coconut oil or palm oil. طبعا والحاجات كمان اللي احنا اكتشفنا انها بتدخل في كل المأكولات عندنا في مصر يعني الفاتس اللي هي vegetable fats احنا عارفين انها مضره جدا، يمكن ما بيحصلش عليها هايلايتنج على انواع الاكل المختلفه، انواع الجبن وانواع منتجات الالبان والحلويات. فدي نقطه مهمه قوي، واظن جمعيه ضغط المصريه طلعت الجايد لاينز فور ديسليبيديميا كان فيها شرح كافي للاكل ايه اللي يتاكل وايه اللي ما يتاكلش، وارجو ان حضراتكم كلكم تشوفوها لانها مفيده جدا، بتغير مفاهيم مهمه عند البيشنتس بتوعنا. WHO recommendation for physical activity in different age groups for children and youth between 5 and 17 years should do at least 60 minutes of moderate to vigorous exercise daily. For prevention, active play, less TV viewing and video games. A recommendation for Center of Disease Control بتقول 2 ساعات فقط يوميا TV viewing and video games. طبعا ده يمكن صعب قوي، ومنها طبعا الموبايل. More exercising and physical activity, healthy eating habits, weight loss, medication. This is a team approach how to prevent type 2 diabetes and the cardiometabolic complications. Endocrinologist, physician, general practitioner, diabetes education, dietitian, students, family, school, and media. This is the main message. Changes will take time. Begin by taking a small few steps. Thank you very much.
Thank you, Professor Inas, for important and elegant lecture. وحقيقي كان انا عندي سؤال حضرتك جاوبتيه. اول حاجه اول كومنت ايه الانسيدنس او prevalence of obesity في children and the young adults in our community in Egypt. حضرتك عندك اي knowledge about this؟
لا مش عندي الحقيقة، بس بيتهيألي إن في كامبين معمولة عشان الأوبستي دلوقتي، مش عارفة إذا كانت هتشمل الصغيرين ولا لأ، بس أنا عارفة إن في كامبينز معمولة عشان سكرينينج فور أوبستي، فإحنا مستنيين يكون في
مستنيين
نتائج
بالظبط.
إن شاء الله.
كان السؤال الثاني بتاعي ان احنا how to prevent، حضرتك جاوبتي عليه في last part of lecture، لكن اعتقد ان الميديا is very important. يعني هي توعية الناس. يعني احنا لازلنا اطفالنا الفاست فود هو جزء كبير من الدايت. لازال الموضوع الموبايلات والقعده قدام التلفزيون فترات طويله لازالت موجوده. احنا بنتكلم، بس اعتقد الميديا لازم تتحرك معانا، ولازم يبقى في مشروع قومي ازاي نفهم الاطفال ان to prevent this important problem. ان هي دي بدايه السيركل I think. young او children obesity and start diabetes hypertension and so on. فطبعا تعاون اندوكراين مع اعتقد البيدياتريك مهم قوي في القصه دي مع الميديا يعني. any question؟ تمام. Thank you بروفيسور إيناس.
شكرا.